To the Roots of Chantal Show, where we talk about beauty, health, fitness, and much more. So stay tuned because you are not going to want to miss this one. Welcome to the Roots of Chantal Show. I am Marjorie, your host, and today we have an exciting guest. Dr. Eudene Harry is with us, and she is going to be talking to us about the microbiome and the connection that our brain has with our gut. Dr. Eudene, thank you so much for being here with us today. If you would please give us an introduction about yourself, tell us a little bit of how you got started with holistic medicine, where you started, and what it is that you're doing now.
Thank you for having me, Marjorie. I'm very excited to be here. And good question. So I became a doctor about 30 years ago, and for about 13 of those years, I was practicing emergency medicine because I trained in emergency medicine, and I'm still board certified in emergency medicine. And during that, my time in the emergency department, I started noticing a pattern of people who came in and they just didn't really understand what wellness was. And also during that time, I started experiencing my own issues. And one of the things that happened with me is like, of course, all my tests were normal and all of those kind of things, but I just wasn't feeling well. So it really kind of fueled my transition into looking into uh, whole health medicine, as I like to call it. It's just basically looking at the whole entire person because I got very used to diagnosing and treating with because that's really what the emergency room is set up for, right? You have a
Mhm.
pneumonia, I'm going to treat that. You have a bacterial infection, absolutely very skilled with that. But when it came to like lifestyle wellness and nutrition and all of the things that impact our health, I felt that I needed to learn a little bit more about that. So then I started looking into that. I found a group of the American Board of Holistic Medicine, and I kind of trained with them and became certified with them. And about 15 years ago, I started my own practice and in wellness medicine. I call this Oasis Wellness and Rejuvenation Center because I felt that was a place where I can really have the time, take the time to sit down and get to know patients, which is really why I went into medicine in the first place. I wanted to get to know my patients, understand them, just really become part of their team because the patient is ahead of that team and I'm just part of the team.
That is awesome. That's wonderful. And you know what, Dr. Udine, I just want to thank you for being one of those doctors that actually takes the time with their patient and doesn't rush them out. Because we know that a lot of doctors, and a lot of time, not even by choice, it's just because they have to. They have to see a certain amount of patients per day, so they can't spend an hour with each patient. So I just want to say thank you for taking the time with your patients and looking at them as a whole rather than just individual things going on with them, and treating them more as that whole person from the holistic point of view. So we are going to dive in and get started, and I'd like to first discuss the role of the digestive system, what it is, how it works, and I guess the moment we put food into our mouth, what is going on with the digestive system?
Good question. So our digestion actually starts in the brain. So when we think about food, if we think about it, we're thinking about that barbecued, whatever it is. We immediately start salivating. So our brain starts a
Mhm.
digestive process, starts prepping the body and say, "Hey, we're getting ready to eat." So when digestion then starts in the mouth, so saliva actually has digestive enzymes that's why we need to really chew our foods properly so it can really start to mix in with the saliva and start being digested properly, mechanically broken down. Because ultimately, the responsibility of the GI system is to take that food, break it down into the smallest components, that smallest usable components, absorb it, and then the body takes that and converts it into energy. So we have the digestion continues in the stomach, and then it gets passed on to our intestinal tract, and in that intestinal tract, we have a lot of bacteria or microbes that takes part in the digestive and absorptive process. So our body kind of works in concert to take food and convert it into energy. It's akin to your car. your car uses gasoline for fuel, but gasoline doesn't start as gasoline. It starts as a crude product that is then converted into gasoline, which then your car can use in order to power itself.
That is amazing, and I love the analogy with the car. That is awesome, and it makes it a lot easier to understand. And you know what's crazy? I was saying, can you explain the process from the moment we put food in our mouth? But as you stated, it starts in our brain. That is so crazy. And it makes sense too, because like if you see a lemon or even if you think of a lemon, it's like you'll start salivating and those glands like it's almost like you'll taste that sourness before it's even there. It's so crazy how our minds and our guts are connected in that form as well. But now I'd like to talk about a little bit absorption, right? Because we've heard that term, you are what you eat, and we've used that for many years, but now we're starting to realize no, it's not you are what you eat, but it's you are what you absorb. So in many cases, we know we're not always absorbing everything, or are we? So that is the question. Dr. E, can you talk a little bit more about absorption and what that entails?
That's a really good question because ultimately we can eat the same foods. You and I can have a similar plate of food. We can eat the same foods and absorb something differently because our body's doing something differently. We might have different microbacteria, might have different amounts of digestive enzymes. Some of that may be related to our environment, to our stress levels, and some of it may be genetic in origin. So ultimately, the key thing is not only eating well, because we still need to eat well, right? We still need to eat the foods that have the nutrients, because if we eat foods without nutrients, there's no way we're going to get any. So we still need to do that. But then we
Mhm.
need to assess like how well that individual is at absorbing those things. So if you're not able to absorb the nutrients from the food that you're eating, then you run the risk of developing a nutrient deficiency. And nutrient deficiencies can show up in many different ways. It really depends on what the deficiency is. So some people who have issues with their stomach, they may not be able to absorb vitamin B12 very well, or magnesium very well, or iron very well. And so they can become anemic or iron deficient, which can be it's not the same thing. Anemia and iron deficiency, they are related. But ultimately you can start experiencing things like fatigue because vitamin B12 is part of our energy process, right? And
Mhm.
iron also helps to fuel our red blood cells, which provides oxygen and nutrients. So all of those things kind of work together. So if we start experiencing nutrient deficiencies, there are a lot of things that we can experience. We can experience fatigue is usually a very, very common one because our body
Mhm.
really depends heavily on these nutrients in order to have energy. But it can range from brittle nails to hair to changes in your skin to premature aging. All of those things can be signs of nutrient deficiencies, your gum bleeding. So ultimately, when you're seeing your physician for these symptoms, and you should,
Mhm.
and they've worked you up and you don't have anything, they say, well, everything looks okay, you may be experiencing a nutrient deficiency that you need to look into.
I love that you explained it that way. And also for our listeners, guys, definitely take this into consideration because if you ever go to the doctor and you have all your lab work done, your blood work, and everything comes back normal, but you are still feeling fatigued and tired, or like Dr. E said, brittle nails or hair, skin, you know your body best, right? So even though all the reports came back good or nothing wrong, you could be suffering from a nutrient deficiency. And that could also be caused from malabsorption. So not absorbing your food. So even though you might be eating a great diet, fruits and vegetables and maybe your little cheat food on the side, um, you may not be absorbing it. So this is something to really take into consideration. I think especially in the day and age of supplements, we're taking all these supplements, right, to supplement our diet. So we're eating healthy and we're also taking supplements. But what good is it if we're not absorbing it? So the first thing is we definitely have to tackle our gut health to make sure that all that wonderful food we are consuming is actually being absorbed. So the next question is going to be the microbiome. Dr. Eudene, what exactly is the microbiome? Where is it found? What does it do? And what is the significance of it?
So microbiome really refers to all of the other bacteria and viruses and everything that's kind of living in our gut from our mouth all the way down. And so ultimately that's called the microbiome. Believe it or not, I believe we have more of those kind of individual microbes than we do human body cells. So there's a lot of it that lives in us, and many of them are good, right? The probiotics, and pro means for you, and so many of them are good. And that's where the word probiotics come from. So they're there. When I say they're good, they help with digestion, they help with absorption, they actually help in producing nutrients. So, for example, some of them produce vitamin K for us. So they kind of live in a symbiotic relationship with us, and help us to kind of live healthier lives. And this microbiome is tied to things like our moods, it's tied to things like our immunity, right? Because it helps us to fight things off. And inflammation, weight gain, all of these things where we're finding out mental issues such as depression. In fact, even Alzheimer's and Parkinson's seem to have a tie to the gut and how healthy our microbiome is, because it helps to defend the gut, protect the gut, helps us with absorption and digestion. So, pretty important stuff.
Yes, extremely important. And so that begs the question of, if we were to fix our microbiome, like if we're struggling in that area, could we fix mental conditions or situations such as anxiety, depression, like you mentioned, Alzheimer's and Parkinson's? Now, I don't know if it will have a major impact on those neurological diseases, but things such as depression and anxiety, would it be safe to say that if we fixed our microbiome, we could actually fix our anxiety and depression, and have more mental clarity and more focus and less brain fog? Would that be something that we could possibly consider?
Interestingly enough, a lot of research is pointing towards that. Some of the research is, of course, in animal studies, because that's where most of our things start. But a lot of the research is actually pointing to that. For example, a gut
Mm.
has its own neurological system. It's called the second brain, and it's called the second brain for a reason, because it produces a lot of neurotransmitter similar to the brain does. There's a direct path from the gut to the brain, and they communicate both ways. So what impacts one, it seems, ultimately impacts the other. So it is seeming that there's a really strong tie between the gut and the brain. And that's where the term the gut brain axis is developed.
That is so interesting. That's insane, and it actually reminds me of, I was reading something about the vagus nerve. I think that's what it is called, and it's like it talks about a whole pathway from, I believe, the brainstem all the way down, to the gut, and so it's like this one big long connection going straight down, and it's just it's crazy how it just connects everything from our thoughts to our gut. And it makes me think of, when you were younger and maybe you had a crush on that certain someone and you developed those butterflies in your stomach. Well, I wonder, is that connected? Like just the thought of someone, or, if they came up to you, you got so nervous and you had the butterflies in your stomach. Is that connected? Is that kind of along the lines of what they mean when they talk about the brain gut connection or the brain gut axis?
Absolutely. Many of us, we talk about things like a gut feeling, right? And that's the brain
Yes.
and the gut connecting. And and so you feel it in your gut and you go, I have a gut feeling. We've been using these
Yes.
terms for extended periods of time. And now we're finding out that we're using them for a reason, because there is a huge connection between the gut and the brain. So, yeah, that butterfly feeling, that anxiousness, is definitely the connection. You talked about the vagus nerve, and it's one of the longest nerves in the body, and it's called the wandering nerve for a reason, because it just kind of meanders from the gut all the way, and it makes many stops. So, the health of that really can impact even our heart, our lungs, all of those things can get impacted. So, there is a very strong tie.
Mm. Dr. Udine, can you tell us a little bit more about the whole two brain thing, when they say there's two brains, what exactly are they saying? Like, we know we have a brain in our head, and then we know the second brain, they're referring to the brain in our gut, but we don't actually have a brain in our gut, right? Or do we? But so, like, what exactly are they referring to when they say the two brains? Because I know you did mention that some neurotransmitters are produced in our gut. So is that what they mean when they talk about the two brains?
Yeah, when they're saying the two brains, that's what they mean. We have the enteric nervous system, which means it's the nervous system in the digestive tract, the
Uh-huh.
enteric system. And then we
Mhm.
have the system in the brain. And those things do communicate with each other. Yeah.
So, moving along now towards a little bit more on the mental health aspect, what exactly is the connection between mental health conditions and, or, neurological conditions and the gut, or our gut health, or the lack thereof?
Ah, that's it. So it turns out that, like I mentioned briefly before, is that the gut actually produces a lot of our neurotransmitters, and so the gut can produce serotonin, the gut can produce dopamine. The gut produces neurotransmitters that our brain produces, but it also turns out that inflammation in the gut, inflammation that starts in the gut, can find its way to the brain and create changes in the brain that can then impact our moods. And there are some studies, again, the primarily studies initially started in animals, when there's a study that was done that replaced the microbiome of an anxious mouse with a
Mhm.
mouse that was not anxious. And what they found out was that it helped the anxious mouse feel not so anxious. And so what we're finding out is that these bacteria themselves, they themselves may actually be producing chemicals that then impact the way the brain behaves. So we really just, even though it seems that we've done a lot, I feel we've got so much more to learn about the gut brain connection.
Oh my God. Guys, did you hear that? Did you hear that? So, what you're saying is these gut bugs that we have are producing chemicals, or I guess releasing chemicals, I don't know. And that is causing us to think a certain way or feel a certain way. It's causing us to have certain moods or mood swings. That is crazy. Oh my goodness. And it's also crazy that we have so many of them, so many good and bad bacteria. And Dr. E, I remember you said that we have more bacteria in our body than we have human cells. That is insane. Because we have, what is it, billions or trillions of cells, and we have more bacteria. Oh my goodness, that is just it's astounding when you really think about it and put it into perspective. That is a lot of bacteria. And then on top of those bacteria, they are producing even more chemicals that is, or that, yeah, that is influencing our brain. So that's insane. So I just wanted to kind of repeat that so you guys understand and get the gist of like how profound this is. This is crazy. And then they're microscopic. They're tiny. Like it's so crazy that something so small can have such a big effect on an organism so big as ourselves. But they must be there for a reason, definitely.
Yeah, they're there for a reason. I don't think they're there just to hang out and, have a few drinks. They're actually working.
Speaking of a few drinks, let's talk about the connection of the microbiome and alcohol. Is it good for us? Is it bad? Because a lot of people will turn to alcohol. It's like if they have a cold or an infection, maybe take a shot of rum, lemon, and honey. So, what is the effect of alcohol on our microbiome? And of course, I know the shot is probably not too bad, but what are the effects of drinking too much alcohol in regards to our gut health?
So many of us, we think of alcohol as an antiseptic, right? Because that's when you watch those old movies, right? And you see
Mhm.
somebody has a cut or a wound or a stab wound or something, they go, "Get me the bottle of alcohol." Let me pour it. Let me pour it on there. But
Right.
it turns out that alcohol may not necessarily be killing the bacteria, but it does seem to have an impact on changing the type of bacteria that we have in our gut. Or, in other words, giving those that are not so great for us the upper hand. it changes the environment so much so that the bacteria that we don't necessarily want to be at the top of the food chain creates an environment for them to be at the top of the food chain. And so our good bacteria tends to be suppressed a little bit more the if we drink too much alcohol, and that's how that can happen.
Thank you, Dr. E. That makes total sense. Yep. So I guess you guys heard it. Lay off on the alcohol, guys. At least not too much, not too much, in limited quantities. But so now I want to go towards leaky gut syndrome. What is that? I have heard about it and I'm a little familiar with what it is, but I don't understand it completely. Can you share with our listeners what it is and what is the significance of the damages that it could cause if one was struggling with leaky gut syndrome?
Yeah, let's talk a little bit about leaky gut syndrome. So imagine this, right? So you're going to a club and then you've got the bouncers and the velvet ropes, like keeping out the riffraffs, right? The people that
Mhm.
you don't want to get in. And on letting in the people that you want to get in. So the gut lining is kind of like that. It's there, they're very tight junctions. It's created to let in things that the body can use and to keep things out that are too big, that are going to be inflammatory, etc. Now there are certain things that can damage the lining of the gut and create bigger spaces in between those junctions. So the cells of the gut, they're kind of tightly packed like this, and they only let in certain things. So
Mhm.
certain, for example, anti-inflammatories, NSAIDs, non-steroidal anti-inflammatories, can create a disruption in that junction, and then bigger particles get in, and that can get our immune system like fired up, right? Because they don't recognize it. It's something so different than they've seen before that they start forming an immunity to it, and then that can create some inflammatory changes, and that's where leaky gut can start creating a problem.
And I love how you use the analogy of the club and the bouncers and letting people in and trying to keep people out. So that's a good way to think of it and remember leaky gut syndrome. So now, with that being said, are there any foods or supplements that we could take that could help us to ensure that we don't get leaky gut syndrome, or if let's say we already have it and we want to repair the gut, what are some foods or supplements that we could take that would help repair or close those junctures and make them tighter so that the bad guys don't get in?
So the key thing that you want to do there is to make sure that you're feeding the good bacteria, right? And fiber is really important to do that. And many of us, our diets don't contain enough fiber, particularly soluble fiber. So we're supposed to, it's recommended about 25 grams to for women and upwards to 35, 40 grams a day for men. And many of us don't get enough of that. And one of the reasons that is so important, not because it keeps us regular, that's important as well. You want to, bind things and take them out. But you also want to provide food for the good bacteria. If they're not fed properly, they're not going to grow and they're not going to be able to help you out. So the first thing that you want to do, you want to eat well, and then you want to, if there's anything that's causing the inflammation, you want to remove that. So if you're eating foods that are tend to be more irritating to the gut, you want to remove that. So things like trans fat can be more irritating to the gut. uh, Alcohol can be irritating to the gut. So anything that's irritating to the gut, you want to remove it. For some people it may be very different. Some people are gluten sensitive, so they would want to remove that. So whatever is irritating in the gut, you want to remove that, and then you would want to re-inoculate the gut, right? And get the bacterial ratio back. So if you've got an overgrowth, you mentioned that before, Marjorie. If you have an overgrowth of the bad bacteria, and sometimes you can take probiotics, it's not going to help. So you need to actually treat the overgrowth of the bad bacteria first, and then you can put the good bacteria back. And the key thing also is not just the amount of good bacteria that you have, but the diversity. Like they need to be different. So diversity is important as well as the amount. That's important. Um, Fruits and vegetables are really important, especially if you're looking at the berries. It's very interesting. The berries not only are important for brain health, so we find out what's important for what helps brain and heart also helps gut. So it's really interesting that all of these nutrients that we seem to kind of separate out, they kind of do similar jobs. We need foods that have contain zinc, for example. We need foods that might contain like the amino acid glutamine is also kind of healing to the gut. So it's just eating a well balanced, colorful plate because you want all of those nutrients, you want all of those antioxidants, and each antioxidant tends to be represented in different vegetables and fruits. So we've got the purple ones, and they're usually high in the anthocyanins, and then we've got the orange ones, and they've got your beta carotenes, and so it's like making sure that your plate has a representative of colors on it was probably one of the easiest ways to include foods that keep your gut healthy.
So, moving on to medications, let's talk about antibiotics. What are the harmful effects of antibiotics, if any, or things such as antibacterial soap?
Okay, so it's called antibiotics because it kills bacteria, right? It kills life. And so it doesn't discriminate between a bad and a good. It will tend to wipe all of them out. Now, antibiotics are important, of course. If you've got a pneumonia or a bacterial infection, it's very important. But if you have a cold, for example, but that's caused by the cold virus, an antibiotic is not going to help that, but it can create a disruption in the flora in your gut. So ultimately, that's why in the medical field we've just become more cognizant of that, and it can not only create, of course, resistant strains, which are a big problem for sure, but it can also disrupt the gut flora and give the bad bacteria the upper hand and disrupt the diversity of the gut, which is something that we talked about that's really important as well. And antibacterial soap is pretty much the same thing. We don't really need antibacterial soap, right? So the soap we have that we've been using for a very long time does the trick. And so antibacterial soaps, I don't know if you remember way back when where it was a thing and almost every soap was antibacterial. And then you notice that they started dialing that back because we don't want to create super bugs that we have nothing to treat them. But also the gut wants diversity, and it wants the good bacteria, the probiotics, to have the upper hand so that the whole body can function the way it should. So
Right.
judicious use of antibiotics is what I'm saying. Use them when they're needed and don't demand them when they're not needed.
I think a lot of the times we've gotten so accustomed to just asking our doctor, "Hey, can you prescribe me some antibiotics?" Because we have a cold or a minor infection. Well, when I say infection, I know certain infections do require antibiotics. And one of the things that not too many people are aware of, I know you're aware of, Dr. Eudene, you're a doctor, and other doctors know this, but a lot of people, patients, we don't realize that antibiotics are for bacterial infections and not viral infections. So when we go in there with a cold, which would be viral, we're thinking we need antibiotics, but it's like, no, antibiotics is not going to treat your viral infection. It's only going to treat a bacterial infection. So I say this to tell our listeners, don't be so quick to ask the doctor for antibiotics because you may just have a viral infection like a cold. And, it's one of those things you kind of just have to let it run its course and get through it, because when you take these antibiotics, now you're disrupting the good bacteria in your gut and you didn't even need it because your infection was viral and not bacterial. So I just want to put that out there, and thank you, doc, for sharing that information, because I think a lot of us do kind of abuse that. Hey doc, can you prescribe me some antibiotics, when in fact, we think it's like, yeah, let me just get these antibiotics because I might need it, or I have an infection, and we just assume. But in many cases, we are doing much more harm than good. So I appreciate you for explaining that to us and letting us know that we should not abuse that. I don't want to say power as a patient, but sometimes, most of the times, our doctors will prescribe it. And also, too, I think when COVID came out, we were all going crazy about the antibacterial soaps and the hand sanitizers and, antibiotics. We were all trying to stay as germ free as possible, and we kind of got into that phase of super cleanliness. And not to say, we shouldn't practice good hygiene, but at the same token, we don't want to overdo it because, like you said, it could create super bugs. And definitely we don't want that, because then that will create resistance to certain antibiotics, and then they just won't work at all. So let's move on to the next question, which is talking about how we can increase our good bacteria by taking certain probiotics. So, for example, yogurt. I think we all have heard that beneficial bacteria is found in yogurt. But what I have realized is that a lot of yogurts contain a lot of sugar, and some don't even have probiotics. So you really have to read the label and make sure that you are getting those lactobacilli and oh God, what is it? Bifidus or something like that. Oh my God, I know I'm probably butchering the names, but and Dr. E, I'm sure you know all those. I know there's so many different strains, but I know you can name them off. I can't, but I do know to look for those strains and to look for something that doesn't have as much sugar, because sugar is kind of I guess the antagonist, I guess, to the beneficial bacteria, and can cause more of the bad bacteria to grow.
You're right. There's a lot of added sugar. Okay. So when you're buying the fruit yogurts, so when you see them say strawberries and blueberries, and I mean, there's usually a lot of sugar in it. Okay. So I usually say get Greek yogurt, which usually tends not to have any added sugar. Greek yogurt, and add your own fruits and vegetables. So you can add your own blueberries, your own strawberries, even if they're not fresh, you can add frozen ones, kind of blend them up together to give yourself that kind of fruity, sweet taste that you're looking for, and not have people dictate how much sugar you should be eating, but do it yourself. So Greek yogurt is a good is a good choice to have. The type of bacteria, well, there's so many different types. Like I could sit here and we got the Bifidium bacteria. We've got a lot of the Lactobacilli series. Like, for example, Lactobacilli salivarius is thought to really help with tightening the junctions of the gut. But keep in mind that we're still really at the early stages, and a lot of these studies have not been cemented in stone, let's say. So ultimately, when you're looking for a probiotic source, you want to look for diversity in the probiotic source, and the amount of cultures. So most probiotic have billions and billions of cultures right now. When you see CFUs, you see like a billion or something like that.
Mhm.
Ultimately, some people might find that creating like bloating in their stomach if they start off like that. So, start off with smaller amounts, or start off with the foods that have the probiotics, because they also provide not only probiotics but prebiotics. And prebiotics just really refers to the food that nourishes the probiotics. And so sometimes people need prebiotics and not necessarily probiotics. So you talked about yogurt. We've got kimchi, right? We got kefir. We have the kombucha. So there are many different forms of sauerkraut. So the fermented foods tend to be high in probiotics, and those kind of foods can absolutely help to create diversity in the gut. There was a study that was done. One of the universities out in California, I won't mention their names, but they did show that those kind of prebiotic foods and probiotic foods can create diversity in the gut, which is something as we get older, looking at aging, which is something that I'm very into right now, is healthy aging. Looking at the way we age, diversity in the gut is so important for those of us who want to live longer, healthier lives.
Yes, and speaking of living healthy at any age, let's talk about this book, Be Iconic. Dr. Eudene Harry wrote this book, and let me tell you guys, it is absolutely amazing. I'm going to just flip through it, and I highlighted a couple things. I'm just going to flip through and let's see, read something here. Okay, let's see. Oh, this is perfect. See, look. Change your thoughts, change your feelings. Change your feelings, change the way you experience the world. Changing the way you experience the world puts the control back into your hands. We need a healthy brain to begin to generate a healthy thought. And then the next is talking about nourishing the brain and different things that we can do. I'm telling you guys, this book is absolutely amazing, and it's available on Amazon, on Dr. E's website. And of course, we'll be sure to put down all the information in the show links. But with that being said, Dr. Eudene, can you talk a little bit more about mental health and how it is connected with our gut?
A lot of research that points to the fact that our mind can actually impact the health of our gut. So, for example, increased stress levels has been shown to change the makeup of the bacteria in our gut. And you're absolutely right. If a bacteria in our gut changes, then it can impact our thoughts and our moods. And so then we have this cycle that starts cycling, and we have to intervene at some point to change that. So, absolutely, your thoughts, chronic stress levels can impact the diversity of the gut. It can impact the lining of the gut. So that's why it's a whole health approach. And so ultimately, if we target one thing, even if it's by taking a supplement, if we target one thing, we might be missing the whole picture, the whole person, all of the other things that have triggered it. And for me, it's like one of my favorite things to say is just imagine, we all think that we if you pee in one side of the pool, it will eventually get to the other side of the pool. So there's one
Mhm.
thing that it can impact so many things, and all of the things kind of tied together. So it's ultimately just taking a step back and looking at everything that's contributing.
Right, we do. We have to take that step back and look at everything as a whole, going back to holistic health and holistic medicine. So I love that. I absolutely love that. And it just brings me back to everything starts in the mind, right? Like whenever we're going to embark on a new journey, before we do it, we have to think about it first. And then we have to not only think about it, but commit ourselves to it. So we can take the example of starting a weight loss program or starting a new diet. Before we do it, we prepare our minds, we prep our meals, we get our workout outfits ready. Or for example, if an architect is getting ready to design something, they have to draw it out, prepare the blueprints. Everything that was thought of, what or I'm sorry, everything that was created was first thought of. It was first a thought. Nothing that was created, everything was a thought. It all started with our minds. And so I think, just to emphasize on the power of our minds and on our thought process, it's so important to just like let everyone know that, guys, you are powerful. You are powerful beings. Just by a simple thought, you can affect the health of your gut. Now, of course, it's not to say that thinking alone is going to affect the health of your gut, but thinking starts the process of healing, because when you have positive thoughts, your gut is actually not in a form and not in a state of constant stress, and therefore can actually heal.
Oh, I mean, the brain is the mastermind of the show, right? So if we have about 70,000 thoughts a day, it's estimated roughly around that.
Wow.
And if the majority of those thoughts are stressful or demeaning to ourselves or belittling ourselves, or we're the only person that our thoughts are with us, like all of the time. There's no like getting away from it, going on vacation from it. So if we have 70,000 thoughts, and like even half of those are creating a stressful environment, sometimes the brain can't really tell the difference between whether reality or not. It's if you're thinking it and creating it, the physiological response of the body is going to be similar, right? So it's going to send out stressful signals, and the body's going to respond in a stressful way. So the gut responds, and then the adrenal gland responds, and it's going to respond as if you're in actual physical danger, because that's the stress response system. One of its primary function is to keep us safe, is to keep us away from danger, is to tell us when to take flight and when to fight. And that's ultimately what it's there for. And if we're having thoughts that's constantly keeping that heightened, and I'm not saying that some of these thoughts are not because of external factors. Absolutely. Our jobs can be stressful, and they can be a stressful environment, and we can talk ad nauseum about that. But ultimately, our thoughts definitely impacts the rest of our body, because it creates a biophysiological response from the body, and the body will respond as if it's in a stressful situation. And so ultimately, you don't need to, when you're in a stressful situation, you don't need to rest and digest, which is what the parasympathetic system does and the vagus does, right? So when you're relaxing, that's when you're absorbing optimally. But if you're in that fight and flight response all the time, then digestion and absorption is not going to be optimal.
And that makes so much sense, because if we're living in chronic stress, yeah, how can our body heal? How can our body repair? How can our body digest? Because it's worried about fighting what is and a lot of people compare it to like running away from a lion or a tiger, and it's like, yeah, your body is fighting for its life. It's not worried about digesting food, or I mean, obviously, yes, it's going to pump your heart and get blood flowing, but it's not worried about the vital organs. It's more worried about, hey, can your arms and your legs move fast enough? Can you run fast enough? Can you produce enough adrenaline to get the heck out of there so you can escape danger? But it's like nowadays, we're not facing lions and tigers and bears. We're facing traffic stress. We're facing stress of being late for work. We're facing relationship stress, financial stress. These are stressors that are causing our heart rate to increase and causing us to be stressed out, um as though we were being chased by a lion, tiger, or bear, when in fact we're not. And like you were saying, Dr. E, the body doesn't know any different. It just knows that we're in a state of stress and fear and danger. And so it just breaks down the healing mechanism or the digestion process or absorption process. And no wonder we can't heal. No wonder our guts are leaky gut, and just, and then of course, if we're not eating right, that makes it even worse, right? Because here we are, we're not eating the proper foods, we're eating processed foods, and we're living in constant stress. So yeah, it's absolutely insane, but it's amazing, what we can do, what the brain can do, the connection, our minds, and how, just staying more positive and thinking, I guess, healthy thoughts and having those healthy connections can actually affect other areas. Just something as simple as meditating or just remaining calm in what used to be a stressful situation. And I think that's why we have to be more aware of what it is that we're thinking, and more aware of what we're allowing to stress us out, and to just stop that so that we can um create a healthy microbiome, and in turn create a healthy brain, because like you said, they are symbiotic, and so they have that symbiotic relationship. So I'm so excited. This is an awesome interview. Dr. E, you are amazing, and I can't wait to continue going a little further down the rabbit hole. Is there anything that you may have experienced personally or professionally, um, while practicing holistic medicine or even allopathic medicine, that you may have seen that connection of the mind and the body? And it doesn't have to necessarily be the gut, but just the mind, and how it's had an effect, whether positive or negative, on the human body.
Oh yeah, like when I started my the wellness practice that I have now, about whatever it was, about 15 years ago, it was that was part of my primary issue. Like, I was feeling horrible. I was overweight. I was struggling. I was stressed out. I was doing the crazy things that people do, right? So you're thinking, even though people think, oh, you're a doctor, you know all of these things. But you've seen unhealthy doctors, right? I mean, it's just, it happens. So even though doesn't necessarily mean that you do. So ultimately, what it turned out, I finally realized, I'm like, I don't need to be on a popcorn diet Coke diet. I really need to be on something that is my primary issue was I was stressed out and overworked. And so it was giving me all of the things that I was doing was not working. So ultimately, I think what people see on the outside, they can relate it to weight. So we'll talk about that. We brought that up a few times, but they can relate it to that. Like one of the things that you're seeing, if you're like struggling and struggling, and you've done all your due diligence and your thyroid and all of that thing. I'm not saying that stress is the only reason that we're overweight, but it can be a significant contributor because we make poor choices when we are stressed out. Our
Mhm.
body doesn't respond as well when we're stressed out. So for me, it really took, that's when I started learning about meditation and stress management strategies. These things were not taught in college, they were not taught in medical school, they were not taught in residency. It's almost like we were supposed to already know how to cope with something like overwhelming stress. We had no idea that, we say it a lot, but I don't think as a society that we're really getting it. It's not, we can say it, but our actions are not saying that we're really connecting with the words that we're saying and the research that we're producing. So for me, I feel like, and I'm not sitting here telling you that I'm the most stress-free Buddhist or a monk, or just, I'm not. Okay. I still have a lot of my moments. I have a toolkit that I have to remind myself all of the time. Like when I get into these modes, because as a human being, that's going to happen.
Mhm.
There's no perfection here. I am probably one of the most flawed people I know. There's no perfection here. But it's like having that toolkit and understanding that everything that you do and think and all of those things has an impact on your health. So when I do fall off, and I fall off, I fall down, I have to get back up, I have to remember my basics. I have to, and so it's ultimately understanding that, and for me, reminding myself of the connection that kind of puts me back on track.
Yes, most definitely. And I think just you mentioned connection. Everything is connected. Everything is connected. And guys, like just understand that when one area or organ is affected, it usually affects the other because we are all connected. Everything is connected. And this is why it's so important to treat the body as a whole as opposed to individual parts. And Dr. E also has written several books, guys, has some guides and tips and tricks on her website. So definitely be sure to check that out. Dr. Eudene, if you can, just give us a little insight on some of those books and the guides that you have available.
Well, I've written several books, like you said, that will be iconic. Is the last one I did, but I have one that's called Anxiety 101. That was written quite a few years ago. That shows how long anxiety has been a part of my life. So that was written, and Living Healthy, Looking Younger was also one that I wrote, just kind of talking about the basics. Because for me, it's so important to understand this vehicle that is with us 24/7. I don't want to understand more about my phone than I do about what's going on with me. And I'm not telling you anybody out there they have to know biology and chemistry and all of the things, but just understanding how your basic body works is really important. So that's one of the things I strive to do. On my website, dreudine.com, you have some access to some guides as well, and also for those of us who are exploring plant-based eating, I have some guides on that as well.
That is wonderful. Thank you so much for sharing that information. And speaking of plant-based eating, is there is there a specific diet that you might recommend? Because there's a lot of talk of the ketogenic diet, the Mediterranean diet, the carnivore diet. There's so many different diets out there and they all have, their benefits, but is there one in particular that you might recommend?
Such a good question because culturally we're so different and our foods are different and all of those things. So when we are looking at diets that have been researched more extensively than other ones, one of the diets that keeps showing up a lot is the Mediterranean diet. And for gut, for brain, for heart, cholesterol level, blood pressure, I mean, this seems to have a lot tied to it. And when you're breaking that diet down, and I tend to like break diets down, like, okay, so why is this a thing? And what I like about that is well rounded. It doesn't exclude one food group. It doesn't villainize any one food group. It talks about eating healthy fats. It talks about fiber. So those kind of foods. So Mediterranean diet is filled with lots of fruits and vegetables, fiber, fish, all of the things that we intuitively know that those are the things that provide the most nutrients, right? So we're always looking at nutrient dense foods. So those are the things that provide the most nutrients. So culturally, you want to look at your cultural foods and see which one of those provide the nutrients, because there are healthy foods in every culture. It's how we prepare it. And we know this to be true. And I know some of you out there will be say, don't be coming for my jerk chicken, all of the other things, right? My barbecued foods. But it's definitely how we prepare it. It doesn't mean we can't have it. It's just means that we really need to see how our body responds to foods and what frequency we need to eat these foods. So it's really kind of looking at your cultural foods and seeing what foods are going to be the most nutrient dense and preparing them in a way that's flavored to your liking with the spices. Like I like things super spicy, so I would spice my vegetables up, right? And I would curry my vegetables and all of those things. So it's just having those foods and preparing them in a way that's palatable to you, which excludes a lot of sugars and deeply fried.
So I'm gonna have to touch on where you said, "Don't come for my jerk chicken," right? Because we know some people are gonna say that, I myself included. Love me some jerk chicken, by the way, and I so. I'm torn because on one end I do enjoy eating meat a lot. And on the other hand, I know that meat doesn't digest as fast as, let's say, fruits or vegetables. And for some of us that might have a sluggish digestive system, the meat could sit there a lot longer than we would like and could even putrefy. So, what are your do you have any concerns with meat? How do you feel in regards to people eating meat? Is it something that you would say, hey, steer away from, or just eat in moderation? What are your thoughts in regards to eating meat? And of course, I'm sure it depends on the person and their individual situation.
So you're right. It just definitely depends on the person and their preference and all the things. And for me, meat is about the prep and the frequency. So we do need protein to heal our gut, right? Because protein does provide the building blocks for healing. Bottom line, right? So we do need protein for that. Protein provides building block for muscles, for immune cells, et cetera, et cetera. So it's important. And meats do have the highest quantities of protein per serving size, right? And complete protein. But we're noticing is that including a lot of plant-based foods really does help. So for my patients who are trying to heal their gut and they're not digesting as well, and you would know when you're not digesting as well. So I know a lot of my patients, they go, when I eat meat, it sits in my stomach and I feel like probably that is the case. So the digestive enzymes may be a little bit lower. So you would want to then kind of work that process through. When you're looking at most diets, like the Mediterranean diet, for example, um, it can include meat. It's just limited, and I don't. Nobody likes the word limited, but it's just like don't eat it every day, because a lot of times it doesn't leave room for other of the nutrient things that you need as well. So over the course of the day, you need a certain amount of nutrients. We're figuring out it doesn't have to be all in one meal every time, but over the course of the day, getting all of those nutrients is important. So for meat eaters, I don't take away their meats. And I don't make I don't say to somebody, you have to be plant-based. But there's some people that need to include more plant-based foods because they just don't have enough to give them the nutrients that they need.
Awesome. Awesome. Thank you so much for that. And I have to just say, this has been an amazing interview. I am so thrilled to have you on the show. But before I let you go, I'd like to ask you if there is one piece of advice that you could give our listeners in regards to gut health and or the gut brain connection, what would that be?
Ah, That's a very good question. In regards to the gut brain connection, I would say to our listeners that one of the things that you really want to do is just pay attention, because a lot of times when our gut speaks to us, right? We talked about butterflies and other things. We have bloating, discomfort, all of the things. Pay attention to it, because it's really not only telling you about your gut, but it may also be telling you about the health of the rest of your body, which includes your brain as well. So when you're thinking about your gut, also think of your brain.
Wonderful advice. So, you guys heard it. When you're thinking of your gut, also think of your brain, or vice versa. So, thank you so much, Dr. Eudene Harry, for coming on the Roots of Chantal show. I am so grateful that you were able to take the time and bless us with your presence. Thank you so much for the information. And I definitely look forward to having you on the show again.
Thank you, Marjorie, and I hope to see you again.
Thank you. Take care, guys. Goodbye.